मैं डॉक्टर सत्संगी और आज आई वांट टू स्पीक टू यू अबाउट व्हाट इज माइंड बॉडी कनेक्ट। इसको बहुत बार होलिस्टिक हीलिंग में एक बॉर्डर लाइन पर रखा जाता है। बॉर्डर लाइन का मतलब नॉन प्रोफेशनल पीपल या ऐसे व्यक्ति जो उपचार संबंधित जानकारियों और उपचार संबंधित विज्ञान से इनडायरेक्टली जुड़े रहते हैं और मरीजों से जुड़े रहते हैं, वो भी इन माइंड बॉडी हीलिंग को ज़्यादा कदा माइंड बॉडी इमोशनल एक्सेस के नाम से बोलते हैं। और जो मेडिकल लाइन के लोग हैं, प्रोफेशनल पीपल हैं, वो इनको माइंड बॉडी एक्सेस के नाम से जानते हैं। माइंड बॉडी एक्सेस इसलिए क्योंकि जब हम माइंड की बात करते हैं तो हम समझ जाते हैं कि हम किस फैकल्टी की बात कर रहे हैं। जब हम पेशेंट को माइंड बॉडी कहते हैं तो हम ये जानते हैं कि माइंड बॉडी, तो माइंड सिर्फ हमारे मेडिकल साइंस के एंगल से सिर्फ माइंड ही नहीं है, वो ब्रेन है। ब्रेन से जुड़े हुए न्यूरोट्रांसमीटर हैं जो 1% ब्रेन को डिफाइन करते हुए पाए गए हैं। और इसके अलावा हाइपोथैलेमस, पिट्यूटरी एक्सिस, एंडोक्राइनोलॉजी और अलग अलग ग्लैंड्स का भी एक मिलियो सामने आता है। पूरे के पूरे हार्मोन और केमिकल सिग्नल्स की भी एक मिलियो, एक इन्वायरमेंट सामने आती है। तो जब हम माइंड बॉडी कनेक्ट बोलते हैं मेडिकल साइंस में, तो वी अंडरस्टैंड द साइंटिफिक टेनेट ऑफ दिस एक्सिस। सो फ्रेंड्स, mind body connect is a scientific language, and mind body connect has been utilized by people from both sides. That means the people into metaphysical phenomena and the people into medical line but not professional, and the people who are professional and who want to pursue a mind body axis to heal certain chronic or incurable entities which there is no documented medical line of actions or which are regarded as non-curable. So mind body axis is utilized to speak to them, to do something out of medical text, so that ultimate part is that they get healed. So how we define mind body healing in a scientific term? You require to understand a perspective of science behind presentation of mind body axis. So mind body axis is something where the thought process, your persona, the people around you, your temperament, and the changes in the body phenomena due to change of weather, due to change of planetary motions which causes morning evening, we call diurnal changes. All these affect your personality, and this personality affects your mind body axis and the presentation of your persona at different time at different specific location. So this planetary motion, seasonal motion, and the action of all the 5 subtle energies inside you result into upplay of mind body axis. And at one dimension of this mind body axis, the disease picture also comes up. So as a doctor, when we see a disease picture, we only understand the play of etiology from the point of view of chemistry or the organ systems. But once we get into the mind body healing, there is a very open avenues, a methodology of treatment which gets opened not only for medical professions but for the patient himself without the help of medical profession. So here comes the role of mind body axis in healing. So at Dr. Satsangi, when I speak to you about mind body axis, it means that I intend to heal you, and that healing is beyond the medical text. That healing methodology is an amateur methodology that is not documented with the text, but that methodology is part of our art of medicines. That methodology our doctors, physicians in their practice has been utilizing from time immemorial in the treatment phenomena, but they were doing it as a part of their art of medicines. But it can be well defined and can be well reutilized from mind body treatment axis. What is that? It is the fact that the mind has an effect upon the body, and we call them somatotypic presentation or somatoform disorder or psychosomatic diseases. So the body is into 5 realms, that is called prana body, and the astral body, and the causal body. And then comes your body, and the Killian photography has very clearly spoken about the aura, that is called pran part. So the changes in the thought process, the vrittiyas which we are born with, they have an effect upon our thought process, and the seasonal and diurnal variation results into changes in the prana levels and disposition to a particular sequence of disease. And once we understand the mind-body axis of healing, we understand that medically, if there is a nutritional deficiency due to chronic disorder, that requires to be done from the medical point of view. But if there is a changes which requires to be done at the level of mind, we need to do it through mind-body axis. So a new phenomena which has been defined by lots of doctors across the globe is epigenetics. So epigenetics is how the thought process, how the vritti affects the genetic information. So that signal system requires to understand that is understood from mind-body axis. So mind-body axis is a signaling system of the subtle energies which comes into play when there is a disease. So if a doctor and the patient participate in understanding the unwinding of this systemic signaling phenomena, then the same results into annihilation of a disease. So a disease coming up and going up to some level is functional. It is not structural changes. Before it becomes a structural changes, you require to meet a person who looks into mind-body healing from the medical point of view, and that psychosomatic changes and functional disorders can be well treated without the organ involvement. Meanwhile, biomarking with us helps in the body axis, mind-body axis, body axis, biomarkers. All this is something which is integration of a thought process called humoral medical systems. This is a thought process of integration of yoga, where the pranayam or pranasana is going to help you out. Thank you, friends.